We've seen a really significant decrease throughout this month. We've actually only seen 2 new cases of Fredericksburg residents within the past week, which is very exciting. Percent positivity for the city is down to 2.1%, so another good indicator that even though we do still have some cases of COVID here, we've seen a really significant decrease. In terms of COVID-19 vaccination trends, I'm sure you all heard that yesterday Virginia hit the 70% of adults have now been vaccinated. That was a very exciting mark. We are a little bit behind that in this area, but I will give the caveat that we're missing quite a bit of data. So we can tell as a state the number of state residents who have been vaccinated, but we don't have the local, like the address to match to each of those cases. So they're not all being matched to the locality. So everybody looks a little bit low. We look extra low because any doses administered by the federal government, which includes military and then federal agencies, we haven't gotten the locality data for that. And given the number of commuters that we have and the number of active and former military in the area, we just know that that's impacting our numbers a little bit. So that's my disclaimer. For our 18 and up, we're at 15.3% who have received at least 1 dose, and 47% are fully vaccinated. So that's kind of the comparison to that 70%. Again, a little bit low, but low relative to the state, but definitely trending in the right direction. You can really see when you look at the Fredericksburg data that vaccination rates increase with age. So among people over the age of 70, over 87% are vaccinated. Over the age of 60, it's 81%. When we look at people over the age of 40, we're at 60%. Over 60% are vaccinated. But then among our younger people, so 20 to 29-year-olds, that drops to 29.7%. So we at the health department recognize this is an area that we need to continue to work. I will say that on this sheet, you can also see the data for 10 to 19-year-olds. Obviously, 10 and 11-year-olds are not currently eligible for the vaccine. So again, that one's going to look a little bit lower, just the way that the data is being reported on the VDH website. We are looking at data by race and ethnicity. For the city, the highest rates of vaccination are among the Hispanic and Latino population. The lowest rates that we're seeing are among the Black and African American population, and then white, Asian, Native American are falling somewhere in the middle. With that being said, again, we do have some missing data with this. We're missing about half of the race and ethnicity data for the people who have been vaccinated. So I think a good indication of some areas that we need to continue to do some outreach. But again, it's not going to be a perfect number.
The number of young folks getting vaccinated seems fairly low, and I'm wondering if that will change and whether we're prepared for maybe a surge with kids going to college, like going back to college and stuff. And would we be able to handle that if, we suddenly see kids going, oh, I'm going to school in a few weeks and I need a vaccine?
Yeah, so we have plenty of vaccine available right now. Early on, it was definitely an issue where demand was exceeding supply, and now we're seeing the reverse. So we will be able to handle that. I think one other thing that's really promising looking at the city when we see these larger numbers is that, at least from our current understanding, UMW is requiring the vaccine for students coming back on campus. So not everybody's associated with the university, but I think that is, when we think about the overall community immunity, that's a promising indicator.
Right, and I guess I'm wondering, about not only kids coming to University of Mary Washington, but all the local kids who are going elsewhere too, like whether we're prepared for that. So thank you. I guess the second dose seems to be lacking for folks, and I guess I was watching the news the other day that talked about how while we try to schedule people 3 weeks or so for the second dose, that just getting the second dose, even if it's beyond those 3 weeks, is still okay to do.
Correct.
And I guess, how do we get that message out? Because I've heard from people like, well, I need to start over or whatever. So is there a way for us to help get that message out that just get that second shot?
Yeah, I think that's a great question. There's no limit to when you can receive your second dose. We recommend Pfizer after 3 weeks and Moderna after 4 weeks. But really, it's not exactly time bound. And if you have something else that day and have to get it a few days later, it's not a big deal. We have tried to get that message out. It's been probably a little while since we really touched on that, though, so I think it's great to hear that feedback, that maybe that's something that we as the health department need to push out a little bit more. And I know that between Brenda and Sonia, they're great at getting that information out through their channels as well.
I guess just my last question. While you were talking about mobile clinics, is it possible, or is there a thought to going to events that are being held in the community? Is that a possibility? Because there's an event this Saturday that hopefully will be well attended, and throughout the summer there seem to be a lot of events now that things are reopening, and there's that possibility. So I guess, is that a possible plan of action to do mobile clinics at events?
Yes, I do think it's possible. It's certainly possible to send outreach team to just have conversations with folks, which really, I think a lot of people just don't know where to go with their questions, and I'd rather they talk to our staff than just Google it. But I think in terms of looking at mobile clinics and just having those vaccines on site so we can have somebody answer their questions, and then if they're ready, we're right there. I think that's certainly an option. And then I know, I'm assuming Pride is what you're referring to this Saturday. We just learned today what a large event that's going to be. We're reaching out to that organization to see. I don't think we'll be able to bring vaccines on site, but we're hoping to have some presence there, again, just to answer questions. Thank you.
Let me talk a little bit about the mobile clinics. Is there a way that we can, what's the best way to know where the mobile clinics are going, and what can we do to get the word out about those? Have you reached out to the school system for newsletters? We produce things weekly that we can send out and call our families.
Yeah, so we put it out in a newsletter that goes out every Friday, and we're
Right.
putting out the clinics that are taking place the next week. I know not everyone is subscribed to our newsletter. We
Right.
also post them on our social media and website.
But if
I
I
think
just keep a
sharing to
track of the
schools-
newsletters is the best way.
Yeah,
Right.
I don't think I've sent them specifically to the schools, except for like James Monroe, where we were
Right.
at the school site.
Right.
But if schools are able to share that,
Right.
that's a great mechanism to get the word out. So.
Right, great. I also just wanted to comment on, I'm concerned that as a matter of public health, that some of our data is just so insufficient. And I don't know what kind of investment it is needed at the state or the national level to support having better data to support vaccination efforts that can save thousands and thousands of lives. So I'm concerned about that, and it's not your purview, of course, but just as an observation, this whole pandemic has proved how vital public health is, and that it really needs to be invested in and reconceived, that we all play a role in public health, and we need to devote the resources that are needed to protect ourselves. Thank you.